Hi, welcome to Advanced Rehabilitation Services. My name is Maria Duran and I am a board-certified occupational therapist. Today we will be talking about the topic of lymphedema. We're going to start talking about what the lymphatic system is. The lymphatic system is a network of organs, vessels, and tissue that work together to remove lymphatic fluid into the bloodstream. The job of the lymphatic system is to protect the body from infections by destroying old or abnormal cells the body does not need. It also helps the body to absorb fats and collect extra fluid. Next, we're going to talk about what is lymphedema. Lymphedema is the abnormal accumulation of protein-rich fluid in one or more parts of your body. There are two types of lymphedema. There is primary lymphedema, which is also known as genetic or hereditary lymphedema, and there is secondary lymphedema, which is caused by trauma, surgery, radiation, parasites, or any other issue that may affect the lymphatic system. Next, we're going to talk about what are some of the symptoms of lymphedema. One of the most obvious symptoms of lymphedema is swelling of the affected part or parts. There are also complaints of heaviness, achiness, and there are skin changes that might be obvious to some clients and or therapists. Some of them are hardness of the tissue, also known as fibrosis, blotching of the skin, pitting edema, which is fluid accumulation that when pressed leaves a pit. There is also browning edema, and browning edema is when the skin feels dense because of an increased amount of connective tissue in the area. So what happens when lymphedema goes untreated? There are long-term irreversible conditions such as disfigurement of the affected area or areas, as well as an infection that can occur called cellulitis. The issue with cellulitis is that once it occurs, it has the tendency to reoccur subsequently for any reason. Now we're going to talk about the treatment. There are two stages to the treatment. The first stage is known as the complete decongestive therapy or CDT. This stage comprehends of manual lymph drainage or MLD, bandaging with short stretch bandages and foam, education on skin, nail, and lymphedema precautions, and education on decongestive exercises. Stage 2. This stage comprehends of fitting of compression garments, education on putting them on, taking them off, wearing and carrying schedule of the compression garments, assessment and prescription of a pneumatic pump as needed, and scheduling a follow-up appointment. Usually I will schedule a client for a follow-up appointment 4 to 6 months after our last visit. If you have any questions, please feel free to reach out. I look forward to working with you on your path to better health.